All right, so picture this. You've got a wound, right? Maybe it looks kind of minor, nothing crazy. But then it just blows up, gets really bad really fast. And now doctors are calling it, get this, a potentially life-threatening infection. No joke. We're diving deep into that today. Necrotizing soft tissue infections. Someone sent us a medical review on it, and wow, this stuff is intense.
Yeah, and it's not some rare thing either. Most doctors, they're going to see this at least once in their careers. It's that common. So every doctor out there, listen up.
Yeah, seriously. Everyone in healthcare, pay attention. But this isn't only for the doctors, right? I mean, if it's as aggressive as you're saying, then knowing the early signs, that could be like life or death for anyone.
100%. And the review, it stresses that over and over, early diagnosis is key. It's like if you can get diagnosed and treated within, say, the first 12 hours, your chances of bouncing back are way higher. But every hour you wait, the risk goes up.
So we're talking about a real medical emergency here, but before we get into all that, let's make sure everyone's on the same page. What exactly are we talking about here? Expert speaker, could you break down necrotizing soft tissue infections for us? What are they?
Well, put simply, it's an infection that's basically eating away at your flesh. Yeah, no, kind of gruesome. It's attacking the tissues under your skin, the stuff that connects your muscles, even the muscles themselves. And it's kind of wild, actually, how the name for this has changed over time. Necrotizing fasciitis, hospital gangrene, Fournier's gangrene, almost like they were trying to come up with scarier and scarier names to match, right?
Yeah.
Yikes. Yeah, that's a history lesson I could have lived without. But you know what's even scarier? This review. It says that over half of these cases, they're misdiagnosed at first. That's like flipping a coin with your life.
And the tricky part is, the early signs can look like a run-of-the-mill infection. Redness, some swelling, pain, the usual suspects.
So how do you tell the difference between like a spider bite gone wrong and something that could, start destroying your tissue? What's the big red flag to watch out for?
Pain.
Yeah.
Seriously, pain that's way worse than it should be based on how the infection looks. If someone is in a lot of pain and what you're seeing doesn't match that intensity, that's a huge warning sign.
Okay, so let's say you're a doctor and you have a patient come in with this insane level of pain. Your spidey senses are tingling. What do you do? How do you actually confirm that it's this flesh-eating infection we're talking about?
Well, this review, it says it often takes a bit of detective work, and the most reliable way is to go in surgically and see what's up. What they find, well, let's just say it's not pretty. We're talking dead tissue. And the pus. It's not your normal pus. Imagine like dirty dishwater.
Okay, yeah, I'm feeling a little queasy now.
And if that wasn't enough, there's this thing called the finger test.
The finger test, please don't tell me that involves actually, sticking a finger in the...
It kind of does, yeah. Surgeons, they can gently probe the area with a gloved finger. If the tissue separates easily, that's a bad sign. It means the infection is breaking down the tissue.
Okay, so graphic, but effective, I guess. We've talked about surgery being the gold standard, but what about those fancy imaging tests, MRIs, CT scans, all that? Can those help at all?
They can, but it's not always clear-cut, especially in the early stages. It's like trying to spot a tiny crack in a dam before the whole thing bursts. For infections in the arms or legs, MRIs tend to give us the best picture. But if we're looking at, say, the lower abdomen or pelvic area, CT scans might be more useful.
So even with all that technology, sometimes you just got to go in and see for yourself, huh?
That's often the case, yeah. And while the review mentions blood tests and something called the LRNX score, which can be helpful, nothing trumps a surgeon's judgment when there's a strong suspicion of necrotizing soft tissue infection. They're just pieces of the puzzle, not the whole picture.
So we've got this potentially deadly infection that can masquerade as something totally normal, and diagnosis can sometimes come down to a gut feeling and a scalpel. But what is actually causing all this chaos in the body? What kind of bacteria are we dealing with here?
This is where it gets interesting. It's rarely just one type of bacteria. Usually it's a whole team of them working together, a polymicrobial infection.
Like a bacterial gang all in cahoots to cause trouble?
Exactly. And every gang's got its usual suspects, right? You'll often find the usual suspects like Staphylococcus aureus and different types of Streptococcus bacteria.
So the usual suspects are often involved? But it sounds like there's a lot more to the story, right? Like we're just starting to understand the full picture of what's really going on.
You got it. This is where the really cool cutting-edge technology comes into play. We've got tools like shotgun metagenomics now, and no, it's not as crazy as it sounds. It basically lets scientists look at all the genetic material in the infected area. It's like taking a group photo of the entire bacterial gang instead of just identifying a couple of familiar faces.
Okay, so we've got this whole crew of bacteria. Up to no good in the body. What do you do about it? How do you fight back against a necrotizing soft tissue infection?
Well, the name of the game is speed. The review, it lays it out pretty clearly. Surgery, antibiotics, and because you got it. The review, it's very clear on this. Getting rid of that dead tissue, that's priority number one. Ideally, you want to do that in the first 6 to 12 hours after diagnosis.
Wow, that's a really tight window. So what about antibiotics? Do they buy you more time?
Antibiotics, yeah, those are super important, especially broad-spectrum antibiotics. Those can hit a wider range of bacteria. But here's the thing, these infections, they can really mess with blood flow. Makes it harder for those antibiotics to get where they need to go.
So it's like trying to deliver a pizza in the middle of a blizzard.
Yeah, kind of like that. But there's something interesting the review points out. Clindamycin, which is a pretty common antibiotic, it doesn't just go after the bacteria themselves. It actually helps disarm their weapons, like those nasty toxins some bacteria produce.
So it's like fighting the bad guys and taking away their weapons at the same time.
That's a great way to put it. It's a multi-front battle for sure.
This might seem obvious, but I'm curious, what happens after the surgery, after the antibiotics? I mean,
Yeah.
what's the road to recovery actually look like after something this intense?
That's a really important question. A lot of people, they don't realize how big of an impact this can have on someone, even after the infection's gone. The review actually goes into this a bit, highlighting these long-term challenges that a lot of patients face.
What kind of challenges?
Well, think about it. You've just gone through this incredibly traumatic experience. Your body's been through the ringer, right? So the physical and psychological toll, it can be huge. And the review even mentions that almost a third of patients, they end up with major, lasting physical problems.
Wow, a third. That's a lot. So it's not just about surviving the infection, it's about learning to live with what it leaves behind.
Yeah, that's a good way to put it. And that's why support after the fact is so important. Physical therapy,
Mm.
mental health support, even just connecting with other people who understand what you're going through.
Yeah.
Those can make a huge difference.
It sounds like this whole journey from that initial wound that maybe didn't even seem that bad to getting diagnosed, the treatment, and then this whole long road to recovery, it's a lot, not just for the patient, but for their family and friends too, right?
Absolutely. It takes a ton of strength and support from everyone involved. And that's exactly why having the right information, knowing what to look for, understanding what could happen, it's powerful. It can really make all the difference.
You're preaching to the choir here. The more you know, the better prepared you are, right? Especially with something like this, where early recognition can literally make all the difference.
No doubt about it. I mean, it's like they say, sometimes the best treatment is just knowing what you're dealing with early on. So yeah, if something feels off, if something seems wrong, don't wait around. Just go get it checked out. Even if you think, it's probably nothing, it's always better to be safe than sorry.
Absolutely. And it's not just about getting to a doctor. It's about, being your own advocate.
Mhm.
Don't be afraid to ask questions, to really push for those tests if you need to. And hey, if your gut's telling you something's not right, don't hesitate to get a second opinion.
I couldn't agree more. You only get one body, right? You got to fight for it.
Well said. This deep dive, it's been something else. Definitely eye-opening, maybe a little scary, but honestly, I think it's pretty empowering too. Knowing about these infections, knowing what to look for, that's huge.
I see it the same way. This kind of information, it's not about scaring people. It's about giving them the tools they need to take control of their own health and hopefully avoid a really bad situation.
Exactly. Well, that about wraps it up for this deep dive into the world of necrotizing soft tissue infections. We've covered a lot of ground here, from those early symptoms that can be so misleading to the challenges of diagnosis and treatment, all the way to that long road to recovery. It's a lot to take in. But remember, knowing the signs, being your own health advocate, and seeking help early on, those are the big takeaways. Thanks for joining us, everyone, and we'll catch you on the next deep dive.